Good evening, everyone, and good morning. I'm speaking to you from Nangangwal country in Canberra, in Eastern Australia, and I'm delighted to be talking to you again about physical activity, which is the thing I'm maintaining a strong interest in, even in retirement. Next slide, please. We've got the World Health Organization policy, which has a structure for us regarding physical activity. We've never had one before. We've had one now since 2018. In Ireland, we've got Every Movement Counts in the Republic of Ireland as a national framework for physical activity. Next slide, please. In the United Nations and the World Health Organization, we've got a decade of healthy aging, which is focusing particularly on functional capacity, not just on active aging, but on the functional capacity that results from physical activity, which is incredibly important to older people. By the time you're 80, it's more important to be active so you can tie your shoelaces and get out of bed in the morning and look after yourself than it is that you'll prevent chronic disease, because your risks of chronic disease are already established, so that it's really important to have functional capacity as we age. Next slide, please. The key purpose of physical activity as we age is not only to prevent disease, but also to maintain function. And if we're inactive, through older age, we drop below an impairment threshold. So we develop disabilities or functional limitations, which limits our quality of life and ability to self-care. Next slide, please. We have guidelines for older adults, and here are the UK guidelines, which are 150 minutes of moderate or 75 minutes of vigorous activity, and building strength, and improving balance, and minimizing sedentary time or breaking up prolonged periods of sedentary time. And on the right-hand side, I've got some examples of physical activities that older adults can do. For aerobic activities, it's walking, dancing, swimming, aerobic classes, yoga, riding bicycles, yard work, gardening, those kinds of things. And for muscle strengthening, it's actually important that we do specific muscle strengthening activities or recommend them to older people. It becomes more and more important because we lose muscle bulk. We lose muscle fiber strength as we age. Next slide, please. This shows across all countries in the World Health Survey. Next slide, because we'll get the animations coming in. Next slide, next slide. Next slide. This shows that inactivity, and this is the presence of not meeting physical activity guidelines across countries, increases by age, so that more and more people are becoming inactive as they age, for both women and men. Women a little bit more inactive than men across countries, and these are data from dozens of countries across the world. And you can see from age 18 to 29 on the left-hand side, all the way to the 80-plus group, inactivity increases quite dramatically. Next slide. These are some data from the Republic of Ireland. This is showing that physical activity decreases with older age groups. You can see the age groups moving across to the right, and compared to 55 to 64-year-olds, where 34% meet guidelines, that's in red in total, men 40% more than women, 28%. When you move right over to the 75-plus age group, that almost halves. And that really shows that we're losing physical activity as we age. And this figure doesn't include walking. More of that for the Republic of Ireland a bit later. Next slide. Walking makes a big difference because older adults, it's the commonest aerobic activity that they do. So in the Irish Sport Monitor, that's another representative population survey in the Republic of Ireland. If you look at the prevalence of meeting the 150 minutes guideline, the aerobic guideline using sport only, it's about 39%. When you add walking for exercise, it's about 10% more. And when you add walking and active travel to get to or from places, it's about 58% are meeting the guideline of that 150 150 minutes of MVPA, moderate to vigorous physical activity each week. And that's necessary for health. That's a crucial thing. Next slide, please. And data from Northern Ireland are remarkably similar. Here from the Global Physical Activity Observatory, the recent country cards only released a couple of weeks ago on physical activity participation. It's about 55% overall for adults in Northern Ireland. And you can see over on the right-hand side where they come from, the Northern Ireland Health Survey, it declines with age, so that meeting this guideline is only 26% for those aged 75 or more. Note that the overall rate is quite similar to the Republic of Ireland when we included walking. Next slide. The age-related decline in activity, or the increase in inactivity, is not universal. There are some countries where physical activity increases after retirement, in particular China, New Zealand, the Netherlands, and Japan. And I'll let you think about each of those countries and older adults for a second. Why would they be more active in those countries after they retire? Whereas in every other country, in Australia, in Ireland, in Northern Ireland, physical activity declines with age. Firstly, they've got high walkable communities, high bicycle infrastructure. So in the Netherlands, they've all moved to e-bikes and are cycling into their 70s and 80s. There's good recreational infrastructure, which means there are parks and places for people to be active. And there's a culture of physical activity. If you think of China, it's a culture of playing table tennis, doing Tai Chi exercises in the park. If you think of New Zealand, it's hiking and walking in the mountains and walking in the forest. Next slide. But meeting all the physical activity guidelines reduces the prevalence dramatically. Remember, it was 55%, 58% for only the aerobic component. But if you add in the muscle strengthening component and the balance component, it's about 10% of the total adult population and about 5% of older adults. So we've really got a lot to do in the muscle strengthening and balance areas of promoting physical activity. Next slide. So when we think about muscle strengthening and balance, we've got challenges in how to measure it in populations. We've got challenges in how to do interventions to increase balance, for example, is very difficult. So it's more than a walk in a park. That's the aerobic part. That's what we want every older adult to do. But we also want them to have balance and strength training. And that's much more difficult to develop population-wide strategies for. Next slide. So there's settings across everyday life for active living. But these pictures really show things that relate to the younger old group, or the older adults without chronic disease or disabilities. When we move to older ages, next slide please, we get a different set of activities for the 80 or 85-year-olds and older, or people with chronic disease and limitations. We have special needs. We might even need chair-based exercise programs will be sufficient to actually have measurable benefits on their functional capacity. Next slide. Okay, so what happened during COVID? Firstly, we couldn't have structured exercise programs where people met in groups. So there was a reduction in aerobics, in classes, in aquarobics, in pools, all kinds of community programs declined. And the other thing that declined was a reduction in social connections around in-person programs. And this has a physiological consequence, which is a detraining effect, which is if you're inactive for a long time, especially if you're older, your muscles will lose their strength and capacity. It'll be harder for you to get back to the activity that you were doing before you became inactive, which was compulsory during COVID for different periods. It was actually quite a long period of restriction in Australia. More of that later. Next slide. So I looked at how many publications there were about physical activity and COVID, and there's about 10,000 overall in the Scopus database, but 1,000 of them are in older adults. So that's a lot of writing in the academic disciplines around physical activity and COVID for older adults. And I'm only going to give you a tiny window on that this evening. Next slide. Here's some data from the Lancet Medical Journal, which used app data for 140 million steps provided by 1.3 million people in 200 countries, and shows a clear drop straight after January 2020, when the COVID restrictions started. There was a major drop in steps and a gradual recovery after that. But even 2 years later, in January 2022, when we'd been mostly liberated from COVID restrictions, step counts had not regained what they had been before COVID. Next slide. Similar data for Fitbits with different levels of COVID-related declines in Fitbits from millions of users across the world. Next slide. Other similar studies on the right-hand side, you can see the effects of an iPhone or Apple Watch monitoring of millions of people in a de-identified format, where straight after March, a major drop in weekday total steps related to COVID. The same thing on the left-hand side during lockdown. The red bars on the left-hand side show less active than before. Note that's particularly prevalent for younger people. The 60-plus group have a smaller red bar. They were actually a bit less affected. More of that in a minute. Next slide. We found that COVID boosted people's interest in physical activity. They were looking online much more often to learn about physical activity during COVID. They were being nudged to try and be active and trying to work out how. And a Google search showed that their intentions or their interest was peaked during COVID, but not their capacity to be active. Next slide. So how did COVID influence physical activity when people had to be active at home, in a home environment? Next slide. Or online, and weren't able to interact with others one-on-one. Firstly, some people joined the same classes that they had before COVID online, doing moderate and vigorous activity. Some displaced indoor and gym and classes for walking and cycling, because in Australia we were allowed out within a 5-kilometre radius of our house, but we weren't allowed to go near people. We had to practice social distancing. But overall structured activity decreased in many countries, and incidental lifestyle activity decreased. Walking to the shops, those incidental daily trips we make, usually by walking, which are very much health enhancing. Next slide. So let's think about the online approaches that COVID has given to society for older adults' physical activity. Next slide. I'll talk a little bit about a study I've been involved with for over a decade in British Columbia in Western Canada, where we scaled up an older adult physical activity program called Choose to Move over many years, starting in 2015. Next slide. We delivered programs in many places across British Columbia to all kinds of populations, to First Nations populations, many cultural groups. Next slide. And Choose to Move was a program that was delivered across the province, and we've now delivered 1,100 programs to more than 12,000 participants. Next slide. However, during COVID, we had to pivot. We had to use methods from implementation science to deliver and adapt Choose to Move for home access. And this became very popular. We'll talk about this some more, but really people loved it during COVID. Almost all the people who were in the middle of a program stayed with us because they had bonded to the program and they wanted to continue, and online provided a vehicle for doing that. Next slide. So post-COVID, Choose to Move has become a hybrid offering, and we now offer it both online and face-to-face. The online format remains very popular, and we've done non-inferiority trials to show it's almost as effective as the face-to-face. There are some differences, are some limitations, but it's very popular, and we now are still delivering it online because people want it. Next slide. So looking at the recent research, and I'm only looking at a very few studies of the 1,000 studies that I showed you earlier. These are just some trials looking at online programs for older adults since COVID. The first one, a randomized controlled trial of 534 people, increased strength, and flexibility and balance. That's really important. That's what online can do. The second one showed it increased mobility and decreased depression. So that's quite interesting because it has mental health benefits and had very good adherence. The third one, the Granite paper, showed that live online programs were much more preferred by older adults than pre-recorded programs, particularly for mental health and social support. People felt that they were still live engaging with other people, and that gave them a very positive feeling. And looking at the acceptability of these, particularly during lockdown or restricted periods, these kinds of programs were seen as very acceptable by seniors. So to summarize, live online programs are better than recorded, online is acceptable, and there are mental and social connection benefits as well as physical activity, strength, and balance. Next slide. Next slide. This just shows systematic review that shows that older people can use trackers and can use measurement devices. Next slide. So last few slides to summarize. Firstly, the change to home-based online classes and virtual delivery has to focus on safety at home, on screening for chronic disease, on delivery of program and reducing injury risks. You've also got to have a help mechanism, a technical help mechanism, although online literacy for older adults is much better than we think. Next slide. The types of online programs that older adults might engage in are apps on their smartphones, esports, wearables or home workouts online, smart exercise equipment, particularly smart bikes or smart treadmills, or classes or structured programs online. We also know that older adults are online literate, much more than one might think. The data in blue is data from Irish adults from the Republic of Ireland, and you can see that for younger old adults, 81% are online, and for 75 plus, 60% are still online, which are higher than the white text, which shows the global levels. Up to 70% use Facebook and more than other social media. So older adults are particularly on Facebook. Below that, they have smartphones, 80% of older adults, half of those age 75. But there are still some technology gaps in using Zoom and Teams, and motivation. People still like the in-person support that they could get. Next slide. I'm down to my second last slide, I think. There are barriers, chronic disease or limitations, possibly cost, possibly loss of that interpersonal social support, feeling isolated, or preferring to go for a walk, to be outdoors, to be in nature. Next slide. So we have a situation which is increasingly online for older adults, and even with our choose to move, they still want it, so we're still delivering it. Next slide. Next slide. We must target strength and balance. Last slide. My final slide is we need to demythologize that older adults can't use online technologies. They can and they do. Older adult programs are feasible with social support and online activity, particularly if they're live. These programs are scalable and affordable and diverse and can reach many adults, especially those 60 plus. They're supplementary to online programs, but they certainly are something we should invest in and consider in our armamentarium of how to get older adults to move more, particularly focusing on strength and balance that online programs seem to be able to do well. And that's all from me. Thank you, Roger.